Blood-borne pathogens and infection are threats to your safety and the residents you care for. By using the necessary precautions, you can be instrumental in preventing the spread of infection. Because the elderly have weakened immune systems, have illnesses, or are on medications that may put them at risk for infection, it is important you know exactly how infection spreads and what you can do to prevent it. One way infections can spread is through airborne transmission. Airborne germs can travel long distances through the air and can be breathed in by people. Examples of diseases caused by airborne germs are tuberculosis, shingles, and chickenpox. Another way infections can spread is through blood-borne transmission. The blood of an infected person somehow comes into contact with the bloodstream of another person, allowing germs from the infected person to move into the other person's bloodstream. Blood and blood-borne pathogens are sometimes present in other body fluids such as urine, feces, saliva, and vomit. Examples of diseases caused by blood-borne germs are AIDS and hepatitis A, B, and C. Touching certain germs can also spread disease. If you touch an infected person, you are in direct contact with the germ. If you touch an object that has been handled by an infected person, you are in indirect contact with the germ. Examples of diseases caused by contact germs are pink eye, scabies, wound infections, and MRSA, or staph as it is commonly known. Some germs can only travel short distances through the air, usually not more than 3 feet. Sneezing, coughing, and talking can spread these germs. Examples of diseases caused by droplet germs are the flu and pneumonia. There are certain precautions that you should always take to help prevent the spread of infection. By taking these precautions, you can play an important role in infection prevention. First and foremost, you must wash your hands. Wash your hands after touching blood, bodily fluids, or objects contaminated by blood or body fluid. Also wash your hands in between caring for each resident. You still must wash your hands even if you were wearing gloves. Another way to help prevent infections is to keep everything clean. Be sure to clean up spills right away. In some cases, you may need to wear specific equipment called personal protective equipment when dealing with potentially contaminated people and objects. You should wear gloves when you touch blood, bodily fluids, or contaminated objects. You should also wear gloves before touching a resident's broken skin or mucous membranes, such as the mouth or nose. Change gloves between tasks and each resident's care. You should wear a gown, mask, and goggles if you know you might get splashed with blood or body fluids. Remove dirty protective clothing as soon as you can and wash your hands afterward. When handling objects that have the potential to spread infection, take the following steps to help prevent the spread of germs. Clean any equipment that has been used by a resident before giving it to another resident. Use disposable equipment only once. Dirty linens should be rolled, not shaken, and should be held away from your body. Always follow your facility's procedures. No special precautions are needed for dishes or silverware. Normal dish soap and hot water that is hot enough to meet your state's requirements will be sufficient. Change cleaning rags and sponges frequently. Stethoscopes, blood pressure cuffs, and thermometers should be cleaned between each use according to your facility's procedures. Correctly dispose of dangerous waste such as needles. Needles and other sharps should go into clearly marked puncture-proof containers, not the regular trash container. Nursing staff should never recap needles. Throw contaminated waste only in containers marked biohazard and never remove anything from those containers. Frequently check your gloves and other protective clothing for holes and tears. If you see any holes in your gloves, remove them. Wash your hands and then put on a clean pair. If you know that a resident has a disease that is spread by one of the following ways, practice these extra precautions. If the resident has a disease with airborne transmission, he or she should have a private room. Keep the resident's door closed and wear a mask. If the resident has or might have tuberculosis, ask your supervisor for a special respiratory mask. A regular mask will not protect you. Remind the resident to cover his or her nose when coughing or sneezing. Finally, ask the resident to wear a mask if he or she wants or needs to be around others. If a resident has a disease that can be spread through contact, he or she should be in his or her own room, but the door can stay open. Put gloves on before entering the resident's room. Be sure to change the gloves after touching a contaminated object. Remove your gloves right before you leave the room and wash your hands immediately. Don't touch anything until you wash your hands. Wear a gown in the room if the resident has drainage, diarrhea, or is incontinent. Use a disinfectant to clean stethoscopes, blood pressure cuffs, or any other equipment used on the infected resident. If the resident has a disease with droplet transmission, he or she should be in his or her own room, but the door can be open. You should wear a mask when working within 3 feet of the resident. Finally, you should ask the resident to wear a mask if he or she wants or needs to be around others. If you ever receive a needle stick injury or are exposed to blood or other bodily fluids, you should immediately wash the affected area with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate eyes with clean water, saline, or sterile irrigants. Report the incident to your supervisor and immediately seek medical treatment. Some common infections in long-term care facilities include the following. Respiratory tract infections are common in nursing homes. This type of infection includes the flu, pneumonia, and tuberculosis. The cause of this type of infection includes weakened immune systems, pre-existing diseases, and group living situations. To help stop the spread of respiratory tract infections, always wash your hands before and after contact with an infected resident. Also, get vaccinated when possible, and wear face masks in accordance with your facility's rules. Another common infection in nursing homes are urinary tract infections, also called UTIs. UTIs are caused by not drinking enough fluids, certain medications, not wiping from front to back, and catheters. To prevent UTIs, make sure that your residents are properly hydrated and be aware that the medications they take may cause these infections. Most importantly, after toileting, wipe the resident from front to back to avoid contaminating the vagina with bacteria. Skin and soft tissue infections are also common in nursing homes. These infections are caused by moisture or pressure on the skin for extended periods of time. To prevent skin and soft tissue infections, make sure that skin is clean and dry of urine or feces. Also, moisturize resident skin with lotions and reposition them frequently. Check with your supervisor on a regular basis to review your facility's infection control policies and procedures. Remember, your health and the health of your residents depends on proper infection control practices.